Hello guys, welcome to the AY tutorials. In the previous part of the general anesthetics, we have seen what is general anesthesia, how it is given, then what are its advantages and disadvantages, then what the care should be taken while giving the general anesthesia, also the classification and pre-anesthetic medication. And in this video we are going to see in detail the drugs which are used as a general anesthetics. So let's get started. First one is the nitrous oxide. Mechanism: it is weak anesthetic and strong analgesic. Then pharmacokinetics: it is having a low blood solubility, rapid onset, and so recovery is also rapid. Whenever there is rapid onset of action, recovery is also very rapid. Then clinical uses: it is often used in combination with the other anesthetic for maintenance of anesthesia and for analgesia. As we have seen previously that it is having a rapid onset and fastest recovery, therefore for the maintenance of anesthesia it is given with the other anesthetics. Then adverse effects: it can cause diffusion hypoxia. Diffusion hypoxia means there is low amount of oxygen in the lungs because there is nitrous oxide, rapid release of nitrous oxide. Then vomiting. Then sevoflurane. Mechanism: rapid onset and recovery. Pharmacokinetics: low blood solubility. Here mechanism and pharmacokinetics is same as that of nitrous oxide. Clinical uses: commonly used for the induction and maintenance of anesthesia, especially in pediatric patients. Here the question can be asked like in case of pediatric patients, which general anesthetics is used, and your answer will be sevoflurane. Adverse effects: it can cause emergence delirium. Emergence delirium means there is state of confusion, temporary state of confusion actually, and nausea and vomiting. Desflurane. Mechanism: very rapid onset and recovery. Pharmacokinetics: very low blood solubility. It is same as that of nitrous oxide, sevoflurane. Then clinical uses: primarily used for the maintenance of anesthesia in outpatient surgery. Outpatient surgery means if there is any surgery which doesn't require the admission of patient, then in that case desflurane is used. Adverse effects: it can cause airway irritation, coughing and laryngospasm. Laryngospasm means there is a sudden spasm in the larynx, or we can call it as a vocal cords, and because of laryngospasm there is difficulty in breathing and speaking. Isoflurane. Mechanism: moderate onset and recovery. Pharmacokinetics: moderate blood solubility. Clinical uses: used for the maintenance of anesthesia, and adverse effects are: it can cause respiratory depression and hypotension. This isoflurane is having the same features as that of desflurane. Intravenous anesthetics. Intravenous anesthetic agent are a cornerstone of modern anesthesia, and they are providing a rapid induction of unconsciousness. Here is the breakdown of their mechanisms, pharmacokinetics, uses, and some adverse effects. The choice of intravenous anesthetics depends on the patient's condition, the procedure being performed, and the desired effects. Careful monitoring of cardiovascular and respiratory function is essential during the intravenous anesthesia. Propofol. Mechanism: primarily enhances the GABAergic inhibition. Pharmacokinetics: it is having the rapid onset and shortest duration of action due to rapid distribution and metabolism. It is metabolized in the liver. See here, there is the rapid distribution and metabolism, and therefore the onset and the duration of action of the propofol is short. Then clinical uses: induction and maintenance of anesthesia, sedation for procedures. Adverse effects: cardiovascular depression, that is nothing but the hypotension, and also respiratory depression is there. Ketamine. Mechanism: primarily an NMDA receptor antagonist. Pharmacokinetics: It is having the rapid onset and it can be administered by intravenously and intramuscularly, and it is generally metabolized in the liver. Clinical uses: it can be used for the induction of anesthesia, analgesia and sedation. Adverse effects: emergence delirium. It includes hallucinations, vivid dreams, then increased heart rate and blood pressure, and increased secretions. Midazolam mechanism: a benzodiazepine that enhances GABAergic inhibition. So midazolam comes under the class benzodiazepines. Pharmacokinetics: rapid onset, metabolized in the liver, then uses sedation, anxiolysis and induction of anesthesia. Adverse effects: respiratory depression, amnesia and hypotension. Thiopental mechanism: a barbiturate that enhances GABAergic inhibition. Pharmacokinetics: a very rapid onset, distribution is the primary factor in the termination of drug effect, metabolized in the liver. Then clinical uses: induction of anesthesia. Adverse effects: cardiovascular depression, respiratory depression and laryngospasm. Etomidate mechanism: enhances GABAergic inhibition. Pharmacokinetics: rapid onset and metabolized in the liver. Clinical uses: induction of anesthesia, especially in hemodynamically unstable patients. And adverse effects: myoclonus, that is muscle twitching, then adrenal suppression, nausea and vomiting. We have seen all the important drugs which are used as a general anesthetics. So if you are having any query, let me know in the chat box. And if you like this video, please like, share and subscribe to the AY tutorials. Thank you.